Hi, I'm Leah Robinson, and I'm a graduate student at the Bloomberg School of Public Health.
Where and what did you study during your undergraduate education?
I did my undergraduate education at Washington University in St. Louis, and I double majored in psychology and anthropology.
What motivated you to do research on housing?
My first job out of college, I did a 2-year fellowship with the CDC where I was placed in the New York City Department of Homeless Services in their medical office. And so that really gave me a lot of exposure to the intersection between homelessness and public health.
What impact do you hope your research will have?
I hope to do research that can be used to inform policy related to housing and homelessness so they can be more effective and also improve health outcomes at the same time.
Can you give me an overview of what you do as a graduate student researcher?
Sure. So as a graduate student researcher, I'm involved in a number of different projects. All of them are related to housing in some way, but they're using different types of methods and looking at different questions. One project specifically that I've been involved with is a qualitative study that has been looking at how a few policies implemented during the pandemic, such as emergency rental assistance and eviction moratoria, impacted substance use outcomes.
What is one insight you've come across during your research?
Yeah, so one study that was really impactful to me was a study that I helped with during my MPH, which was during COVID, where I interviewed a number of people who were moved from congregate shelters to hotel rooms because of the pandemic. And through a lot of these conversations, it just became really clear how small things that people tend to overlook in day-to-day life, like having an outlet to charge your phone or a room where you could store your belongings, a safe place to sleep at night, how essential those things really are for health and mental health and well-being.
You recently co-authored an article about the structural forces that create and sustain homelessness. How did this article come together?
Yeah, so I worked on this article with another PhD student, Kyle Moon, and our two advisors, Craig Pollack and Sabria Linton. And just with some of the changes that have been occurring with the new administration, we felt like it was important to talk about the evidence of some of these policies that are being changed, specifically related to housing first, which is the idea that it's really important to provide people with housing first before making other types of services a requirement, such as engaging in mental health treatment or substance use treatment. But really the first priority should be making sure that people have a safe place and a stable place to live before adding on all of these other requirements. Housing first is really the ideal that we should be striving for and moving back towards and not away from.
What do your parents think of your career path or your education path thus far?
Both my parents are in the medical field, so they're both very happy that I'm doing something that's medical adjacent. But I think they're very proud of the work that I'm doing, and hopefully that it'll lead to the positive change that I'm hoping to achieve with my work.
Nice. Do you have any mentors, and how have they shaped your journey?
One person I definitely consider a mentor is my advisor from my MPH program, Danya Keene. I still work with her a lot on various projects related to housing policy and homelessness, and she's someone who I still keep in touch with a lot to this day. She's been super helpful in helping me to shape my research ideas and interests, and has been really helpful in helping me to see what's possible in this space.
When you're not working, what do you like to do to decompress?
I mostly like to hang out with my dog, Mac. He's a 1-year-old golden retriever. And I also like to be outside, run, read, go for lots of walks on the harbor.
Oh, do you live right by the harbor?
Mm-hmm.
Oh, that's so nice. What's been your favorite course to take thus far?
My favorite course that I've taken so far was Public Health Law with Jan Bernick.
What's the premise of that course?
It gives an overview of different public health law issues and starts to get you to be able to read legal
legal jargon.
Yeah, and understand a bit more of what you're reading.
So a class that helps you like build some skills. Do you have any book recommendations?
One book that I really enjoyed was called This Is All I Got by Lauren Sandler, and it was about, it's written by a journalist who follows a young mother who's living in a shelter in New York City, navigate living in the shelter system and her search for housing in New York over the first year or two of her child's life.
Do you have any other book recommendations?
Another book that I would recommend is called There Are No Children Here by Alex Kotlowitz, and this is about two boys growing up in a public housing complex in Chicago. True story.
What would you say to an undergraduate student considering a career in public health?
I would tell them it's a great field to be in. It's definitely trickier to navigate than some other fields that have more of a direct path because there are so many different directions you can go in, but I would just say to be open-minded, follow your interests in whatever directions they take you, and be excited about the fact that everyone's path winds in a different direction.